this presentation, and also we can post it. We'll post it on social media platforms and YouTube after the meeting. So today we're very happy to have Dr. Daniel Leme to be with us for this ISL Brown Bag Talk. And let me give you all a brief introduction to Dr. Leme before we get started. And Dr. Leme is currently a postdoctoral research scholar at FSU Institute for Social Longevity at ISL. So he is currently involved in several projects investigating the role of social isolation and depressive symptoms in the relationship between physical activities and the mild cognitive impairments. And he's a physical therapist by training with both master's and PhD in gerontology. During his doctoral studies, he investigated multiple social, psychosocial, and clinical factors associated with frailty among community-dwelling older adults in Brazil, with a particular emphasis on sex differences between older men and women. In addition to working with population-based data in Brazil, he also collaborated with English longitudinal study of aging called ELSA on projects aimed at predicting healthy aging and the future frailty in older adults in England, as well as examining the co-occurrence of malnutrition and frailty and its impact on adverse outcomes in longitudinal framework. So he previously, before joining ISL as a postdoc scholar, he also held a postdoctoral position in public health at University of Waterloo in Canada, where he contributed to projects exploring the use of psychotic in long-term care and their association with worsening behavior, as well as prediction of delays in hospital discharge. So today, Dr. Daniel Leme will be giving this presentation about a recent study they published using explainable AI techniques for healthy aging prediction modeling, investigating social, clinical, and lifestyle factors using population health data. Without further ado, I will just hand this over to Dr. Leme for the presentation. Yeah, please take over, Daniel.
Thank you, Dr. Rizet. Thank you, everyone, to be here.
Yeah.
Thank you for
yeah,
this.
can you share the screen, please, first?
Okay. Can you see my screen?
Yes, we can share the screen. We can see the screen now. Thanks.
Yeah. Thank you for everyone here today. My presentation is about explainable machine learning models for health aging, investigating clinical, social, and lifestyle factors using population data. This presentation will give you one idea about what is the healthy aging definition and factors related, and I will present some data about some results about healthy aging in community dwelling older adults through the English longitudinal study of aging, and future directions about healthy aging intrinsic capacity in community older adults. But first, I will give you some information about my trajectory and research interesting. As Dr. Explained, I'm a physiotherapist and I have a clinical experience in Brazil, especially in clinical and the hospital settings, treating older adults with respiratory, musculoskeletal, and cognitive disorders. And I finished my master degree in gerontology in Brazil as well, where I working on frailty phenotype and multimorbidity and disability as a predictors of survival in old patients. And I finished my PhD degree study multiple factors related to the frailty phenotype in community dwelling older adults based on data from frailty in Brazilian older adults. Specifically, I investigate sex differences in frailty phenotype and association factors in Brazilian older adults. Today's presentation is focused on my study that I did with a collaboration with researchers from the University College College London, specifically using English longitudinal study of aging. In this study, I elaborate machine learning models to predict health aging based on clinical criteria, and this paper was accepted for publication in the Journal of American Medical Directors Association in July 2025. What is a healthy aging? Recently, World Health Organization released this report about healthy aging 2015. According to the World Health Organization, healthy aging is defined as the process of developing and maintaining the functional ability that enables well-being in older age. So healthy aging, according to the World Health Organization, involves functional ability, which depend on both mental and physical capacities, or called intrinsic capacity, and supportive environment. Specifically, these are the components of health aging. What is the functional ability? Functional ability is the personal ability to meet basic needs, learn and make decisions, be mobile, build and maintain relationships, and contribute this to society. And what is the intrinsic capacity? Intrinsic capacity is divided in domains. The first domain is cognitive domain, that is represented by preserved cognitive function, vitality, that is preserved physical capacity, and the sensory domains, that is no difficulty with vision or hearing, locomotion, preserved mobility, and psychological, no depressive symptoms. So in the health aging definition, for health in WHO definition for health aging, it's necessary to optimize these domains um, through the exercise, nutritional support, rehabilitation, and other health interventions. So to have healthy aging, it's important to have a supportive environment, that is a physical and personal element that involve home, community, broader society, people and relationships, social policies, services such as healthcare, accessible supermarkets and banks. But there is different health aging definition. That is a different concept of health aging. That health aging is a biological perspective. So we know that older adults are living long and with disabling disease. So in this concept, health aging also refers to extend the period of life free from disability disease. That is health span extension. So this definition is important because when you identify chronic condition and chronic condition related to the disability in this biological perspective, we can formulate a strategy for health promotion and preventive actions. So the concept and operationalization of health aging is difficult. For example, there are a lot of definition and normative terms of health aging, such as activity aging, resilient and successful aging, and among others. And there is a variation in definition in research. Several theories, measurement tools, and criteria, clinical and biological criteria, social criteria or perspectives, that leads to inconsistency. And another challenge in defining health aging, that is cultural, social, and economic factors affect how people understand and experience aging. So, and a clear definition is important. Of course, when we work with populational data, we need to define health aging, and we need to measure health aging across different criteria to compare with different studies. In addition, there are lots of factors or many factors related to the healthy aging. The literature show sociodemographic factors such as younger aging, BMI, male gender, higher educational and socioeconomic status, lifestyle factors such as normal weight, physical activity, non-smoking, and social and psychosocial factors such as social support and engagement, participation in community-based physical activities, and the life satisfaction. And another point, there is a regional variations. For example, in common predicted health aging for women in Western Europe. And education had a stronger effect on the health aging individuals under 68 in Southern and Central Western Europe. And evidence about machine learning to identify health aging predictors in middle-aged and older adults is limited, considering the multi-dimensional complexity of aging. And why using machine learning to study predictors of health aging? Aging is a multifactorial phenomenon, is influenced by a combination of biological, behavioral, social, and environment factors. These factors can interact with other, and the machine learning techniques are well suitable for studying complex phenomena as they can model numerous nonlinear interactions. And in traditional statistical methods, a high number of interactions can reduce interpretability and lead to low statistical power. And another thing that is important for machine learning is interpretability. Clinically, we can use methods such as SHAP values to provide insights for clinicians, for health professionals, for researchers in general, to verify which factor contribute positively or negatively to the outcome. So the objectives of this study was develop machine learning models to predict the health aging over time using classification models or classification methods such as decision tree, logistical regression, neural network, and unknown forest, and create an interpretable, easy to understand prediction algorithm through the SHAP values, and design a user for clinical settings and public health to prioritize simplicity and clinical relevance in feature selection and model output. And the focus on health promotion. And we can use in this machine learning algorithms to verify factors that we can look at when we look at the older adults specifically. About the methods, this study used the ELSA study data. ELSA study is a population-based study of adults aging 15 and older living in England. The first wave of ELSA was 2002, with physical blood tests collected every 2 years and the standardized questionnaire assessment conducted every 4 years. The ELSA is linked to hospital records and the mortality data as well. These are all the data modules from ELSA study. First is sociodemographic. There is information about the household and individual information, physical and psychosocial health, cognitive function, social care since wave 6, employment, pension, income and assets, housing situation, social support, functional measures, and blood tests. For this present study, we select individuals with 60 years and older who were assessed at baseline, wave 2, and follow-up, wave 4. This is a retrospective study. About health aging criteria, we define health aging criteria based on clinical characteristics of these patients. First one, preserved functional status through the low and broad scale for instrumental activities of daily living, and preserved mobility through the self-report mobility difficult or perceived mobility, and preserved muscle strength based on hand grip strength using dynamometer. And we consider absence of elevate depressive symptoms evaluated by the Center for Epidemiological Study Depression Scale, and preserved cognitive function through the specific cognitive test, and absence of chronic disease that include no self-reported doctor diagnose, such as myocardial infarction, stroke, angina, heart failure, Parkinson's disease, COPD, diabetes, and cancer. So we consider health aging transition as an outcome. For health aging, the individuals need met all 6 criteria at the baseline and follow-up, or improve to meet all criteria at follow-up. This is our all candidate predictors. We divide the candidate predictors in sociodemographic predictors, psychosocial predictors, health and lifestyle, and the clinical predictors. That includes the social demographic information include age, sex assigned at birth, ethnicity, marital status, living arrangement, level of education. Psychosocial variables include desired age, self-perceived age, experience of age, positive social support, and the health and the lifestyle include physical performance through the 5-chart rise test, and balance problems, self-report balance problems, self-report hearing and sign, alcohol consume, smoke status, and clinical variables include total cholesterol levels, HDL levels, triglycerides level, and hemoglobin levels. This is the preliminary analysis that we did to verify the important factors for health aging predictor before training the algorithms. We use in brute algorithms to select important predictors. Before these methods, we included 32 candidate predictors pre-selected at baseline, and after applying Boruta algorithms, we selected 21 predictors that is important variables to predict the health aging in this context. This is the stage of machine learning model development for health aging. The first stage was exclude or remove some variables with variance close to 0 or with high collinearity. And after this, split the data in training and test data, training with 70% of sample, and the test data with 30% of sample. We did data imputation in training data, and all the pre-process was carried out in training data. And we did cross-validation to select the best model, and then training in the test model. To evaluate the models for internal validation, we select all metrics that is common in health science, for example, sensitivity, specificity, positive prediction value, negative prediction value, and the ROC curve, and AUC curve, AUC value, and F1 score. This is the result about the sample characteristics at baseline. The total participants in the waves 2 and 4 was more than 4,000. The median age was 64 years, and women represent the majority. It was 56.5% of sample, and the majority, 22.6%, were in the highest household wealth quintile, and at follow-up, almost 28% of participants were aging healthily. And this is the sample characteristic at baseline by health aging at follow-up. The median age at baseline was 60 years. The women account for 55.2%. The majority were in the highest household wealth quintile. Most participants had normal physical performance. About one-third were moderately activity. The majority reported never having balance problems, and more than half using the internet or email at baseline. This is the performance of machine learning on the test data set. We can see a slight advantage of the random forest across all different metrics used for this study. And this is the most important predictors. And in this chat values plot, we can see the contribution of each variables at the baseline to prediction of health aging at follow-up. The first one, the first more important variable was household wealth, especially highest quintile age groups, younger patients, physical performance, participants with normal physical performance, physical activity, contribute negatively, especially about participants with inactive levels of physical activity. Internet email usage, that people that no use internet and email, this factor contributes negatively to the health aging. Persons with abdominal obesity contribute negative to the health aging. This is just one correction that I need to make in this graphic. This is abdominal obesity, yes, category, not ill, not no, sorry. I will correct it in the paper. Self-perceived aging, especially in people that was younger or self-perceived younger in at the baseline, and the balance problems, that people that related never had balance problems at baseline contribute positive for health aging. Pain status, people with no pain, this is contribute positively for health aging. And people that was extremely satisfied at baseline, it was a positive factor for health aging. As we can see, the red color is factors that contribute negatively to the health aging, and the green color represent the factors that affect positively to the health aging. So that's important to verify that age and the age-related factors were among the main predictors. Of course, being younger at baseline is important when we look at different physical tests and clinical tests. For this reason, we did additional analysis, especially look at the interaction strength among all predictors to verify if aging interacting with physical performance, if aging interact with physical activity, for example, can be more important that isolated factor to predict the health aging. For this reason, we apply the H statistics to estimate the strength of the interaction. For example, the H statistics equal 1 is this means that 100% of variance in health aging is explained by the interaction. So in this plot, we can see the 80 statistics at the maximum than 0.0025. That is, for interpretation, the interaction strength between each predictor and all other predictors was weak, explain less than 2.5% of the variance in health aging predictions. So isolated factors, isolated predictors may provide a better understanding of this outcome through this result. Um, I will give you some summary of finds and implications. The first one, physical performance by the 5-time chair rise test. This test is a simple test that we can do in the clinical routine, and we can ask participants to rise as fast as possible from a chair 5 times without using their arms, and the time in seconds to taking these tests is recorded. And we can classify patients with normal and intermediate and poor physical performance. This test is important to identify sarcopenia, that is loss of muscle mass, strength, and function, frailty and disability, and falls in these patients. So, physical performance is important for older adults, especially in terms of physical health, mobility, independence, and autonomy. And this test is common using in geriatric medicine and is considered cost effective in clinical practice. Another point, another factor important in this study for health aging is a self-reported physical activity. In ELSA, self-reported physical activity is collected through the frequency that people engage in physical activity, more than once per week, 1 to 3 times per month, and hardly ever. And this information to classify participation in different levels, these variables are also identify participants in different levels, such as vigorous, moderate, and mild intensity. So it is important that physical activity in moderate levels um, is important for reduce morbidity and mortality risk in older adults, has the global consensus and optimal exercise recommendation published in 2025 clarify. And engaging in regular physical activity can optimize domains of intrinsic capacity and promote functionality that are core factors for health aging. So another important factor was household wealth variable. In ELSA study, this variable is a measure of social economic status, and this includes financial wealth, savings, investments, pensions, and retirement funds, non-financial wealth, property, business, assets, physical wealth like art or jewelry, and this is important variable because this is an independent predictor and showing strong association with health outcomes, mortality, and frailty in older adults. Specifically, we know that higher socioeconomic status and this is an important factor for healthier behaviors, such as access to the healthier food, opportunities for physical activity, better dental health, for healthcare access, and for psychosocial benefits. And the last important variable that I would like to mention in this analysis, the use of internet or email. In the ELSA study, this is collected by self-reported question. And the question is about the averaging and how often people use the internet or email. And the information collected through these variables is frequency that people use this this resource, such as every day or almost every day, at least once a week, at least once a month, at least once every 3 months, or never. We create a binary variables to represent internet use, internet or email use. We know that internet is important to maintain and expanding the social contacts, and is important for social engagement as well, and as access to the health information. Internet use is associated with improved physical health, um, and the compensation for functional limitation. We know that free individuals has, for example, disability or problem with mobility, and these patients can use internet for shopping, and go, instead of go to the bank and buy something or banking. And we know that internet use is important factor for cognitive function. The literature clarified that initiating using is associated with improved cognitive function in older adults, and cessation using is linked to accelerate cognitive decline over time. About future directions, um, we need more studies with long-term trajectories and transitions of health aging, specifically investigating the transitions in intrinsic capacity as well, to understand the dynamics of health fluctuation in older adults and to support early healthy planning. And we need more studies focus on definition to guide research and empirical comparisons. In fact, it's difficult to define health aging, but a clinical criteria for health aging is important as well to define strategies for health promotion and preventive actions. Thank you very much.
Okay, great. Thanks so much, Daniel, for the presentation. We have some time for question answering. So if people have any questions, please feel free to just unmute yourself and ask questions in the live chat, or you could also type your question in the chat, and we can also answer question that way.
Hi, Joe Otso here. Thanks so much for the talk, very interesting. One thing that I was curious about as you were showing the data was the use of internet and email. And you did touch on part of my question, which was going to be whether you thought it was more so driven by the social connection portion or driven by the cognitive demands of just keeping up with times, thinking about somebody in their 70s or 80s using internet, which they didn't presumably grow up with using. And I was curious to get your thoughts on any additional analyses you may have done to maybe partition that out a little bit. In other words, with some of those subjective measures of depressive symptomology or feelings of well-being, did those seem to have a stronger interaction or independent effect relative to the cognitive tasks? And I can't recall everything from that one list of all the measures, but just thinking about from the cognition point of view, maybe if there's any questions about how often they read or maybe educational status. So just kind of curious on your thoughts on that.
Thank you very much, Joseph, for this interesting recommendation. In ELSA, this variable is just a self-report of internet use, and we can expand this using another variables that include the use of the internet related to the connection with persons, and of course looking at social aspect to verify the effect of these factors on cognitive function of these patients. Thank you very much for this tip.
Thanks.
So Jenna, you have a question?
Yes, thank you so much for your talk. I think I have a kind of follow-up question, that cognitive part. So we are so used to, like, I'm studying pathological aging, and so cognitive reserve is a big factor. And as much as in pathological aging, same as in healthy aging. So I know it's not like one certain test, and it's kind of more like a, you know, like a combination of different things. But in your table there, when I looked at the different variables and predictors, it seemed like that the only thing was like years of education. It's kind of like that was like one of the measurements there. Can you speak more about why there weren't, like, what do you think about cognitive reserve, and how is that actually plays a role in those variables that you actually listed there? Because it's kind of combination of both educational, lifestyle, cognitive reserve is all of these together.
Yeah, thank you for this question. And of course, when I look at intrinsic capacity and healthy aging, I look at I look at cognitive function as an important variable in this context of healthy aging, and of course, level of the education is important in many countries, specifically in Brazil as well. When I did research in Brazil, when we look at the population, the level of the education is important. People with low levels of education has problems in cognition and the physical health, and but maybe in this analysis, other variables are most important when we look at these factors, and when we look at the health aging across these these different criteria. One analysis that I can do for the future study is look at the cognition as uh, um, isolate domain and verify the factors related to the cognitive function. Uh, of course, I can take each domain of intrinsic capacity and look at the different factors related with this domain, this specific domain. And of course, considering level of education is important for this analysis.
Great. Thanks. We'll have a question from Marilyn in the chat. Would the use of texting be also important for those of lower economic means?
The using of texting, it's like, if I understood, texting sorry, could you explain in a different way?
Texting, I think, is sending a text via phone, like messaging people using
Okay,
phones, right? Cell phone. Yeah.
okay. Thank you very much. Yes, of course. This domain can give him important information in terms of cognition and functionality. Because when people doing this type of task, this can improve cognition and functionality, specifically in IDL activities. I think I will look at this data again and verify if it's possible to include this variable. Thank you very much.
Okay. Other questions for Daniel? Yeah, we'll have abundant time to interact and ask questions. So Daniel, I'm a little bit curious about this kind of collaboration. I think you mentioned about this kind of collaboration with UK colleagues. Could you talk about a little bit about the initiation of this project, and also why they kind of why you guys collaborated on this project? Maybe you can
Yeah,
talk
that's
a little about
interesting.
that.
Thank you for remember this. When I was finishing my PhD degree, I had a great opportunity to have a contact with a researcher from the University College of London. His name is Cesar de Oliveira. He's important researcher in ELSA with many collaboration, and Cesar is a Brazilian researcher that lives in London and participating in my PhD defense, and we create collaboration, and he mentioned me to help him and helping researchers in University of College London analyzing data and writing papers in collaboration to expand my networking and to create um, uh, to create a network between different researchers from different countries. That is, of course, important for me, and I, I, I'm pleasure. I was pleasure in participating in this study, of course.
Great. So another question I have related to is related to the setting of your prediction model. So based on my understanding, the data set you have obtained from ELSA includes individuals that assessed at baseline and also 4 years of follow-up. So these people, I think they will ask those questions at the baseline and then ask similar questions 4 years later after finish the initial data collection. So in your setting, are you using the baseline as predictors and predicting the outcome data collected in 4 years of follow-up visit?
Exactly.
Okay.
We use the baseline predictors to predict the health age transition, and we collect all the six criteria for health aging at baseline and follow-up, and look at people that meet all these criteria at baseline and follow-up, or improve this in these criteria during this transition, during this time, baseline and follow-up.
But also wondering if you have you done some sort of subgroup analysis or creating different sub-cohort based on, for example, the age group or gender group? Because I think, health aging outcomes could be somewhat, as you found out from your SHAP analysis, age is most important factors for this health aging prediction model. So I'm thinking since age is such an important factor, what you could also do is to create, for example, create different subgroups based on their age group and then build prediction models for each group and figure out like for each subgroups, each of the subgroups, what are the factors influencing the health aging outcome for each subgroup? Have you considered something like that?
Yes, yes, of course. This is important, of course. When I did the interaction model, I was looking at the interaction between all predictors, and but sub-analysis to confirm this result, because when we look at the interaction model, many variables interacting each other did not result in high variance to explain health aging this population. But to confirm this result, is important to stratify the sample by age, of course.
Okay, great, thanks. And another question I have is about the potential theoretical or implication or practical implication of this project. Because when we develop prediction models or any AI-based models or machine learning models like this, we always like ask question like what this model can do for us, right? In terms of kind of policy making or decision making. So could you share some insights into the potential use cases of this kind of model for real world? Because we do have people on this call from a community. I mean, they're interested in knowing like what can they do based on these results? Can they make some behavior changes? Or is there any possibility to influence policy based on what you found from this study?
Yes, that is the important part of the study. How we can give this information for health professionals, for community. Um, of course, based on the last consensus about exercise published that I showed during this presentation, they emphasize the importance of the exercise and the physical activity for older adults. Is it important mention that doing exercise, engaging physical activity is important for cognition, for functionality, for autonomy, to reduce prevalence of comorbidities and multimorbidity. And the second device from this study is internet use is not um, a bad thing, but it can be good as well if we use, of course, for 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 important things such as um, activities to improve cognition, connect with others, with colleagues. This is part of social life. This is part of social network, and we can create a social network using internet and mails as well. It's important for older adults. And another important part of this study is specifically modify factors as well. Um, Obesity was important variable as well, especially abdominal obesity. This is an important clinical factor, especially in older adults in comparison to other um, obesity measures. Abdominal obesity is related to the health conditions such as cardiovascular risks and inflammatory profile. It is important keep keep fit and doing exercise. In but another important factor is a social aspect as well. Um, Wealth or income or social status is important. Of course, this is important isolate predictors that influence in health in general, cognitive performance and physical health as well.
Yeah, sure. So on a side note, Daniel and I, and we have been also exploring some other data sets that could be helpful to understand potential correlations of physical activities to cognitive impairments and social isolation. So we've been very much interested in exploring that because there's been scientific evidence showing the benefits of physical activities to reduce social isolation, reduce the chance of developing mild impairments, Alzheimer's, or depressive symptoms. But the understanding about which ones are moderator, which ones are kind of mediators are less understandable, less understood. So less understood. So we're trying to do some work with that. So if people have any potential input on this particular research lines, we're very much interested in hearing more, and also we're also very much interested in collaborating on like developing potential intervention that could help in this population. Daniel has a background in physical therapy, so I'm sure he's interested in kind of collaborating with multidisciplinary researchers around campus. So if you have any potential project that you think you might want to hear input from Daniel, also please reach out. So any final questions before we close today's brown bag talk? Okay, so I just want to give you a heads up that we do have 2 more brown bag talks lined up for this semester. One will be given by Dr. Jackie Zhang from College of Education, Human and Health Sciences. And she'll be giving a presentation November 5th, which is a few weeks later. And then we have Dr. Qianwen Guo from College of Engineering giving another brown bag on November 12th. And then we also have invited Dr. Ken Langar from University of Michigan to visit FSU around late January, and he will be given presentations and also engage in some discussion with graduate student and faculty colleagues here to talk about potential research collaborations. So please mark your calendar for January 29th of 2026. So again, I'd like to really thank everyone for their support and engagement with ISL. So hopefully we'll be able to have more events like this to kind of talk about our research and also be able to identify potential collaborative opportunities. And thanks everyone for joining. Hope you have a wonderful rest of your day, and I'll see you next time. Bye, everyone.
Bye, thank you.